welcome. Today, I just want to talk briefly about two exciting new additions to Tin Care and Cover Kids for pregnant and postpartum enrollees. The first of those is the addition of dental coverage for pregnant and postpartum enrollees on Tin Care, and the second is the extension of postpartum coverage for pregnant and postpartum enrollees on both Tin Care and Cover Kids from 60 days to 12 months. Both of these changes are effective as of April 1st, 2022, and we are so excited to see these changes, especially because our nation and our state are experiencing a maternal mortality crisis, and these are great steps in the right direction towards addressing this crisis, particularly because we know that 90% of pregnancy-related deaths in Tennessee were deemed preventable. Additionally, when we look at Black women who die at 2.5 times the rate of their white counterparts, 100% of their deaths were preventable. So these changes are so necessary, and we are so happy to see them put into place. So the first change is the addition of dental coverage to the Tin Care program for pregnant and postpartum enrollees. This change is not available to individuals who are enrolled in Cover Kids in the pregnancy-related category at this time, but we hope to see that soon. This is a comprehensive dental benefit, so it includes the basics like cleanings and x-rays and extractions, but also restorative procedures such as fillings, crowns, root canals, even dentures. So we're really excited to see this dental coverage added for pregnant and postpartum enrollees. And this is so important because we know that oral health is linked to general health. And if you have poor oral health, you're likely to also have poor overall health. And that could lead to very much detrimental health outcomes in the long run. Additionally, Tennessee was one of 3 states that didn't provide dental coverage to any adults. It only provided it to children under the age of 21 due to federal EPSDT requirements. But now Tennessee is providing this comprehensive dental benefit to pregnant and postpartum enrollees on its Tin Care program. The second big change is the extension of postpartum coverage. So postpartum coverage has been extended from 60 days to 12 months for both enrollees on Tin Care and enrollees on Cover Kids. And the coverage through this 12-month postpartum period remains the same as the coverage that was through the pregnancy. So for enrollees on Tin Care, it includes that dental coverage. Those in the 12-month postpartum coverage period are able to take advantage of that benefit. Additionally, this change is so important and such a big moment because it's the first extension of postpartum coverage since 1986. Additionally, 1 in 3 pregnancy-related deaths did occur more than 43 days postpartum. For those who were past the 60-day postpartum period for Tin Care and Cover Kids, they didn't have equitable access or affordable, accessible access to health care, and they probably weren't able to get into the doctor. So expanding this postpartum coverage period will allow these families and individuals more time to get the health care they need and ensure that they have optimal health and there aren't any excess pregnancy-related complications that can be addressed because they don't have insurance. These are great steps in the right direction, and we're so excited to see these changes in the Tin Care program. These 2 policy changes truly highlight the importance of health coverage during and after pregnancy. The next step is improving preconception care. That would include focusing on something like family planning services. Currently, there are limited family planning services available on a sliding scale at county health departments. However, over 400,000 women still live in contraceptive deserts in Tennessee. These are counties that lack a reasonable access to the full range of contraceptive methods. Therefore, the logical next step would be Medicaid expansion, which would cover over 100,000 people currently in the coverage gap in Tennessee, including 31,000 women of reproductive age. Medicaid expansion would give childless adults who have low income the opportunity to access family planning services at a variety of providers, and that could range from things like contraceptives to STD, STI testing, but also regular checkups with a medical provider. So tell your legislators now to expand Medicaid and improve preconception care.